Healthcare and college, university. We already have some government healthcare, though the system isn't as simple and straightforward as it is in many other countries. The federal government already provides Medicare and Medicaid, along with Veterans Affairs hospitals. State governments have their own department of public health, public health department, sometimes with their own hospitals, and some counties, he's in cities, have their own hospitals as well. The rich doesn't have a problem with paying for health care. The poor are covered by programs such as Medicaid. It's mostly the middle class that's being made to pay exorbitant prices for health care. But why? Well, see the two videos, how to fix health care without spending a dime, and how to argue for universal health care here by Shane Killian. The number one problem with healthcare in the United States of America is how expensive it is. The reason why it's so expensive is because it's so heavily regulated. In 1965, the single-payer health insurance programs, Medicare and Medicaid, made poor people less dependent on private charities and more dependent on political institutions and pharmaceutical companies. The healthcare industry gets money from said programs, which makes things more expensive because they can charge almost as much as they want. That same year, the government also took over the training of new doctors, and as of 1997, the number of available spots for training is limited at 110,000 new doctors a year and has not increased since. Even doctors from other first world countries are required to go through this training. Also, the American Medical Association has lobbied Congress and state governments to give its members de facto monopolies on the licensing of doctors, which is done to limit the number of doctors, which increases the price charged by doctors. When it comes to health insurance companies, they face regulations such as not being able to compete across state lines and being required to give coverage for things that the customers don't need, like maternity care for men, infertility coverage for couples that don't want to conceive children, and alcohol addiction treatment for non-drinkers. Between mandates, price controls, and third-party payers such as government, employers, and insurance companies acting as middlemen, no one knows what they're actually paying for their care, and no one has much of a reason to be concerned. When it comes to the Food and Drug Administration, it may as well be privatized. There have been many cases where even if a drug has been used in other countries and is proven to be safe, the FDA won't even let dying patients take it. They test it as the drug for efficacy, not even safety. Compare the FDA to product safety and certification organizations such as Underwriters Laboratories. UL has an excellent track record, getting testing done quickly and accurately. If they don't, companies would go with UL's competitors. If a UL certified product hurts you, you can sue UL. The same can't be said for the FDA, a government agency. As for the FDA being made beholden to pharmaceutical companies, it's already happened. The FDA acts carefully to not upset its corporate sponsors, which provides about half of its budget for drug evaluation. Privatizing the FDA would also save taxpayers $3+ billion a year. In a free market, there is an incentive to lower prices and increase the quality of goods and services, because doing so would earn one money and a better reputation, and not doing so would mean that one does not earn money and they get a worse reputation. With government, the government can just make people pay through taxes, and if there isn't real competition, government-made goods and services would turn out to be low quality. Look at parts of the medical business is that aren't yet heavily regulated, such as cosmetic surgery, LASIK, and retail clinics. For the first two, prices aren't rising exorbitantly, they're actually falling, as that the patient pays directly, which is seen if a breast job, a cosmetic surgery, it costs, say, $2,000 compared to, say, an appendectomy, which costs tens of thousands of dollars in retail clinics, because they provide care that does not require a doctor or full-fledged doctor's office or hospital, but does provide medical care at much lower prices. The American Medical Association doesn't like this and wants to have more control over those parts of the medical business. We see the same thing with technology. When defibrillators were deregulated, they became less expensive, more advanced, and overall better. Same with smartphones, and so on and so forth. Even if lifting price caps means the equipment will become more expensive, this is only in the short term, as that in the long term, prices will go down. Please support the Substack blogs America vs. Europe and the World and Arguments Against Leftism. Here's my social media link tree, which I ask that you keep archive. You keep the link and archive my content. And please